listen to this. Up to 50% of spine surgeries, including back and neck in the United States, are unnecessary or inappropriate.
In fact, low back pain is the single biggest cause of years lived with disability worldwide, and that's according to the World Health Organization.
And today, changing the mindset when it comes to treatment of back, neck, hip, or knee pain.
And joining us are spine neurosurgeon Dr. Ryan Grant, CEO of Vori Health, and orthopedic surgeon Dr. Mary O'Connor, their chief medical officer and former chair of orthopedics at the Mayo Clinic in Florida. Welcome to both of you.
Thank you both for being here.
Thank you so much.
Dr. Grant, the statistics indicate that so many of the surgeries performed are really not needed. And along with you and Dr. O'Connor, you founded Vori Health and are on a mission to empower humanity, if you will, to live a healthier life, right?
That's absolutely correct. So, surgery certainly has its place. It's heavily overutilized throughout the world. This is not picking on any one institution. And so throughout the world, you'll see at least 1 in 4 surgeries, up to 1 in 2 surgeries in this realm, back, neck, hip, or knee, really aren't necessary, meaning a lot of people will get better without surgery. And so really, we wanted to actually leave our practices to really focus on empowering humanity, to really give the support that they need, and having surgery be that very last resort versus way up front as it is used now.
And that's something I've always heard from my father, because he's a vascular heart surgeon. Surgery is the last resort, and I believe that as well. You're also very passionate about this message, Dr. O'Connor, aren't you?
Yes. We believe that we can help people get better without surgery, and that more people can get better without surgery if you give them the proper support and surround them with the right care team. And for those that need surgery, let us help you get ready for the surgery, and let us help you with your journey afterwards. So we just have to do a better job of looking at people as the whole persons that they are.
Mm-hmm. Dr. Grant, tell us exactly how your practice works.
Yeah, so we're a medical provider, so we employ physical medicine physicians, sports medicine physicians, nurse practitioner, health coaches, social workers, physical therapists, literally a whole care team around people. So people can come in either self-referral, their primary care provider can come. We're heavily virtual based, and so put a care team around people based on what their goals are. So if your back, neck, hip, or knee bother you, what are you really missing in your life, or what's most important to you? You have to really personalize that. And so if you're having difficulty walking with your family because your back hurts so much, it's, well, what's your family member's name? Tommy. So the whole care plan's walking with Tommy. Able to write evidence-based, non-opiate prescriptions, able to order imaging if it makes sense. Most people don't need imaging in the first few months. It's heavily overutilized, and 85% of people will reach their goals through this type of program.
How true is that? First thing you hear is X-ray, CAT scan, MRI, go, and then I'm paying out of pocket. I mean, Dr. O'Connor, that's significant what he's saying.
Well, but it's true. We have patients, and Ryan and I experience this all the time in our own practices. Patients come in and they're asking for these imaging studies.
Even before you're telling them they need it.
Exactly. And while imaging is a very important tool in medicine, again, it has to be used responsibly, right? Because most people don't need an MRI for the first couple months, and we can get most people better for their muscle aches and pains and back problems with some good non-operative therapy, meaning physical therapy, health coaching to embrace an anti-inflammatory diet, work on sleep, help with any stress, or maybe some mild depression that a lot of people have. So again, we need to start looking at people more holistically so that we can help them get better.
This is a message that needs to reverberate across the country, around the world. But, let's say I'm bothered by an issue. Why don't you walk me through this process? And most of it's virtual, right?
Yeah, that's correct. So people will come in either self-referral or a referral from their primary care provider. You can find us either online, on the App Store, and schedule an appointment. You'll see 3 providers in the first setting. You'll see a health coach really setting the scene around walking with Tommy. You'll then see an expert physician, usually physical medicine or sports medicine. Make sure you don't have cancer. That's really rare. Make sure that you're not going paralyzed or another rare condition. 99% of the time that's not there, but it's one of the reasons to have a physician there. And then do you meet criteria for pain medications? And then you'll see a physical therapist in the next setting. And you'll go through a 6 to 12-week journey that mixes live providers, the health coaches, the physicians, the physical therapist. And when you're not working with live providers, you'll have offline content that's assigned to you, sort of homework that you use with a health coach to really try to meet your goals. And 85% of people will reach where they want to be within 6 to 12 weeks. And if they don't, the next step would be to consider ordering an image. And based on those findings, we can help people care navigate to a surgeon if they meet criteria.
I think one of the other things that's very important about our approach with telemedicine is the convenience that it provides patients. I mean, I have been so impressed. Even older patients will embrace this technology. And when I asked one of our patients about why she was enjoying doing her exercises with our program, she said, I don't have to have anyone drive me to the physical therapist. My kids don't have to take time off from work. I don't have to have my house clean to have the physical therapist come in. I don't have to have my makeup on and my hair done. I can do my exercises whenever I want in my house coat. And when we create that situation for patients to make it more convenient, they do what they should do more frequently, and that helps accelerate their healing.
Doctor, insurance, lack of thereof, how does that work with the program?
It's a great question. So we're on a roadmap to be able to be nationwide by this coming summer for all services through all 50 states and DC. We're in network with most major insurances. Some employers will actually sponsor, and so for some people it's free. Some health plans will also do that, and so. And then there are also self-pay options. And so we're working as many places as you can as how do you make that cost as close to zero as possible for most people so that you can really empower all of humanity in time.
What's been the reaction so far?
It's been good. It's people's reaching their goals 85% of the time. There's one of the scales that we follow called the Net Promoter Score, which is how well do people like what you're doing, and would they recommend you, remains in the 90% range. And so 9 out of 10 people recommending it to others, and we'll continue to work to try to grow that.
And doctors, any final thoughts?
Really here to pull people's narratives out and really understand what's most important to them. Going back to Tommy, traditional doctor's office, people will be like, do you have any questions? It's not the same to understand what scares you, what's on your mind. People have a lot of fear when they come to the doctor of, am I going to be paralyzed like grandpa? Is this why I'm urinating in the middle of the night? People are thinking about all sorts of things that we really don't traditionally do a good job of pulling out. And so not only just customizing people's care plans based on what's important to them, but also helping remove fear to help them move their path forward.
Dr. O'Connor?
You know, we're really focused on empowering humanity to lead its healthiest life. And when we look at the health of the country and how sick people have become, I mean, even before the pandemic, we understand how hard, how challenging it is to adopt healthy behaviors. And we at Vori can help people on that journey and help them be successful. And that is so gratifying to all of us.
That's great. For our viewers who'd like more information, where can they go?
They can go to our website at vorihealth.com, VORI. They can either Google us also. You can go to the App Store either on the iPhone or Google smartphone and type us VORI Health, and you'll find us and download and schedule an appointment. And we look forward to helping people on their care journey.
Wow.
Great information.
And of course, you know, you can always go to our website, thebalancingact.com, if you want more information. And we'll be back right after this. Thanks so much for being here.
Thank you so much.
Great stuff.